Okay, I'm Molly McDonald, and this is my case study 8, tacrolimus and its mechanism of action, specifically with kidney transplants. So, to begin, a brief introduction of tacrolimus. So, tacrolimus, also known as Prograf, is a medication that is used alongside other medications in order to prevent the body from rejecting a newly transplanted organ, such as a liver. It is an immunosuppressive agent in the calcineurin inhibitor class of medications, also known as CNI. It is commonly utilized in combination with one or two other immunosuppressive medications, such as steroids, mycophenolate, azathioprine, and basiliximab. So, following the transplant of a kidney, the body's white blood cells will immediately begin to try and reject the new organ, in which the tacrolimus will combat such through suppressing the immune system to prevent these white blood cells from continuing their efforts to reject the kidney. And while it is very important and a very helpful medication, it is also incredibly strong and can cause a plethora of side effects, specifically the development of kidney issues or even hurt the body's ability to fight off infections on its own. And here is the chemical structure of tacrolimus. So now onto its pathway and mechanism of action. So tacrolimus inhibits T cell proliferation through the binding of or to the FK506 binding protein, also known as FKBP. And they do this to inhibit the calcineurin activity that is occurring. So by inhibiting this activity, it can interfere with calcium-dependent events such as interleukin 2 gene transcription, nitric oxide synthesis activation, cell degranulation, and/or cell apoptosis. And the FKBP functions include protein folding, signaling cells, cell apoptosis, and transcription. And this bottom photo is a figure of these FKBPs. So tacrolimus can also potentiate actions of glucocorticoids and progesterone through binding to FKBPs that are contained within the hormone receptor complex, which results in the prevention of degradation. And this leads to the enhancement of expression for the transforming growth factor beta 1 gene in an analogous fashion that CSA demonstrates. The T cell proliferation is in response to the ligation of T cell receptors being inhibited by tacrolimus, in which type 1 T cell helpers will be preferentially suppressed in comparison to the type 2 T cell helpers. This ultimately leads to the impairment of T cell mediated cytotoxicity, where B cell growth and antibody production will both be affected indirectly through the suppression of these T cell derived growth factors that are necessary for these functions, and antigen presentation will be spared. So, as a CNI, these tacrolimus work to downregulate the immune system for kidney transplant patients through the mechanism of blocking T cell activation and therefore the transcription of pro-inflammatory cytokines within the cells to avoid the initiation of immune response occurring against the transplanted organ. And by doing so, the immune system cannot properly respond to the transplanted organ to reject it. So it is therefore forced to accept it as it loses the ability to combat the foreign organ. Overall, this drug is majorly important and used to aid kidney transplant recipients to ensure that their body does not reject the transplanted organ. That being said, it is an immensely powerful drug with serious side effects that can occur when not used correctly, overused, or used too often. Dosages must be monitored in their levels within the blood to ensure that the drug is being used efficiently, safely, and properly. And here are my references. Thank you so much.